Had I been able to see somebody, 10 years earlier or 5 years earlier, I might have had a possibility for a cure. My name is Sarah Bednarek. I have stage 4 cancer. I'm on Medicare, and I'm an artist. I had no health care before I became sick. I think it was about $1,000 a month for somebody buying it on the open market, which is just too much. So I hadn't been to a doctor in about 10 years, and it happened gradually. I at first didn't really notice, but I began to start cutting things out of my diet because I couldn't poop. I thought I had food poisoning because I was vomiting a lot. So the people I lived with, my friends, they made me go to the emergency room after about a week. Turned out that my intestines were blocked. At that point, they didn't know what it was, so they had scheduled a colonoscopy. They started asking me for money like almost as soon as I was conscious. And I didn't have any, and they sent the social worker to be like, how are you gonna pay us? And I was like, I don't know. The hospital sent me a lot of bills. I think the first one I got was like $57,000. The amount of money that it costs to treat cancer is astronomical. Unless you're like a billionaire, there's no way that you'd be able to easily afford cancer treatment. My mother had arrived at that point, and through her really hard work, actually, she managed to get me signed up for Medicaid, which was necessary. Once Medicaid kicked in, then all of that just went away, and they paid for it. No one tells me which doctor I can go to. My oncologist has saved my life 3 times now, and the idea of maybe, for example, an insurance company telling me I can't see her anymore, that's awful. A lot of times my friends, for example, will get huge bills, or they just won't, they won't have met their deductible yet, and they'll be paying out of pocket for all of their whatever it is they need, or they'll avoid going to the doctor at all because they can't pay the deductible. And that's not the case with Medicare or Medicaid. If the New York Health Act is anything like Medicare, which it is, it would help the public so much because they wouldn't have to deal with the kind of stuff that I haven't had to deal with for a while. Everybody should have that ability to make the right choices for themselves and not have some sort of corporate interest making those choices for them.